A very good morning, students. Welcome to Pharmacology Part 17. We are here. Most of the doctors are asking, sir, why are you just considering this many number of classes, this many number of parts for a single session, right? See, I have my own schedule, right? I have my own schedule. I'm not like other doctors, so I can get straight away 7 hours of class, 8 hours of class. No. So just want to make sure that you can understand, at least you try to remember at least 60% of what I speak here. 60 to 75%, that will be sufficient for the Neet PG examination, right? But if you want to get a good rank, obviously you should give 100% of your efficiency. You should give 100% of your efficiency. I'm not asking you to take multiple resources, but I'm saying whatever class I speak here, you just study it, revise it, make a notes and try to revise it as many number of times as you can. With that, do MCQs. See, if you don't think otherwise, I will just take 3 minutes of yours, then we'll start the class, right? I will just take only 3 minutes of your time. I will just tell you some tips, that's it. Just some tips I will tell you. Wait, see, previously where did we stop? We stopped at somewhere, right? Antibiotic uses, right? So we should start antibiotic uses. Okay, we will start, no problem. We will start the antibiotic uses. Okay, so I will take just 3 minutes or 5 minutes of your time. You just follow 3 points, right? First of all, revise at least 3 revisions before you go to exam. Second one is MCQs with explanations. Don't forget the explanations. Most of the doctors do this mistake. They only go for MCQ. No, it's wrong. MCQ plus explanations give you the right way. And finally, third thing that you should do is very important thing. Very important. Maintain the schedule in a right way, or right way is something, is other word, but I just want consistently. Yes, right, maintain the schedule consistently. For example, if you read 4 hours today, you just maintain it, that's it. That means either you should increase the time period, but you should not decrease it. Means one day you read for 6 hours, one day you just slept all the day, one day you read only for 2 hours, one day you did not read and you just went to play outside, one day you went with your girlfriend to have fun, one day you read for 10 hours. No, this is all wrong. Don't read like this. See, I know as a boy, as a male, as a gent, I know all the problems of man, as well as even girls also will have some issues, boys also will have some issues. You have a boyfriend, you have a girlfriend, you can have fun with them, you can have all sort of things, but still remember one thing. I want to tell only one thing. Always stick to a schedule. Just something like you just plan for 5 hours a day. 5 hours is sufficient. 5 hours. Just early morning, 1.5 hours. Okay, after bathing, after that you just take it for 2 hours. Have food at 1 o'clock, right? Then sleep, take a deep sleep. Evening, 3 hours. Finish, man. 5, 6, total 6.5 hours. Finish. You maintain this one for the next 1 month. After 1 month, you make it 7.5 hours. Sunday, yes, you can take a break. Sunday, you just read for 6 hours. That will be sufficient. Okay, you have a break. You go with your girlfriend, have fun. See, fun means, I am saying yes, boy or girl, you can have your fun, but still it should be in a limited. It should be limited. Don't make it too much. Don't make it emotional. I just want to say one thing before exam: don't make any emotional nuisance, please. To all the boys and girls there, I am speaking. Before exam, don't make any emotional nuisance. I am saying it once again. Don't make any emotional nuisance, right? You just focus on the exam only. For any refreshment you want to go with your girl or boyfriend, you go. You want to have some fun, sir, we are human beings, we also have some feelings. and we want to have some fun. Yes, you can have some fun, but still no emotional things, only fun, that's it, no emotional things, right? Better to have a chat with your girlfriend or boyfriend, that is okay. Or if you want to have some play, yes, you have a play with them, but be it in a limit, don't make it too much, right? Okay, I think I spoke very depth, I spoke beyond the box. I think we don't need that one. Okay, we'll get into the class. Fine, we will just discuss some uses of antibiotics, right? We just get to know some very good uses of some important antibiotics. Why we should directly start with uses? Because you will get a question which are clinical oriented MCQs, and finally obviously they will be asking what is your most probable drug of choice. Ultimately it can be a clinical MCQ, it can be a some other type, whatever the pattern it can be, but finally the MCQ will be leading towards what will be your most common drug of choice that you will use. Simple. Ultimately the examiner will come here only, the climax will be drug of choice only. He might say like 24 years old male came with a complaint of fever, rash, joint pains, severe vomitings, diarrhea, etc. After a couple of period of time, your reports came like this, or examples came like this, or analysis came like this. Finally, what is the most probable drug that you will be prescribing to this patient? That is, he is asking indirectly drug of choice, right? So always remember, drug of choice is very important. It may not be asked in a direct way, but it will become as a clinical MCQ. So first antibiotic is azithromycin. I will just write only the main important things. There are actually multiple information for it, multiple bits of information for it, but I will write only the important ones. Azithromycin is the main drug of choice for atypical pneumonia, right, which is caused due to chlamydia, mycoplasma and legionella. This statement is very important. That means you should know the clinical features of chlamydial infection, mycoplasma infection, legionella infection, and the examiner will ask you what is your choice of drug, right? Now azithromycin is also used in Campylobacter, and it's also used in cholera, very important MCQ, cholera. And it is also used in if a pregnant woman has cholera or chlamydia. Azithromycin is the drug of choice in pregnancy. Right, wrong, right. Now we will discuss about ampicillin. Where we will be used ampicillin as a drug of choice? Main, it is the drug of choice in Listeria monocytogenes. Okay, and another important thing is Enterococcus fecalis endocarditis. Remember this, very important. But it is not used alone, it is used along with or beside gentamicin, right. Now coming to the next drug, it is ceftriaxone. Ceftriaxone is used as IV drug. First one is ceftriaxone IV is the drug of choice in gonorrhea. You should know all forms of gonorrheal infection, their clinical features, complication, and ultimately you should know the drug of choice, that is ceftriaxone IV. Then with gonorrhea, where we will use in typhoid also ceftriaxone IV, typhoid. But if the examiner asks you the oral drug of choice in typhoid, then it will be cefixime. Cefixime is the oral drug of choice in typhoid. If examiner asks you IV, it is ceftriaxone. Then it is used in Haemophilus influenza infected meningitis, right? Then it is also used in empirical treatment of meningitis. meningitis, right? Then it is also used in infections of E. coli, then Klebsiella, then Providentia, Klebsiella and Providentia. Okay, then what is the next drug? What is the next cephalosporin? Ceftazidime. Ceftazidime is used in Pseudomonas, and if the Pseudomonas infection is severe, then you will use with gentamicin. Okay. Now what is the next antibiotic? Carbapenems. They are actually extended. Remember this. What are carbapenems? They are actually extended spectrum beta lactamase, extended spectrum and beta lactamase producing organisms. Carbapenems are used on extended spectrum and beta lactamase organism, beta lactamase producing organisms, and it is also used in Serratia infection, in Acinetobacter, Enterobacter. And I will just want to add one important note here. Imipenem, you know imipenem? Imipenem is actually metabolized by renal dehydropeptidase and is combined with cilastatin, which is a renal dehydropeptidase inhibitor. You got my part? Actually, imipenem is metabolized by renal dehydrogenase, and it is also combined with cilastatin, which is a renal dehydrogenase inhibitor, renal dehydropeptidase inhibitor. Okay. Now you will discuss another drug called cefazolin. Where is cefazolin used? I think each and every doctor most probably they know. Simple as it is used as surgical prophylaxis. I think we will read this a million times in our MBBS. Right, and where we will use cefazolin? Not only in surgical prophylaxis, but is also used in toxic shock syndrome. It's a drug of choice. Now we'll discuss something about clindamycin. Right. So clindamycin is most commonly it is used as a drug of choice in contacts in meningoencephalitis as well as pyelonephritis, as well as typhoid carriers, then Shigella, okay, then travelers diarrhea, right. Clindamycin is used in people who came under contact with a meningoencephalitis patient, and also it is used in where? It is used in pyelonephritis. It is also used in typhoid carriers. Is also used in Shigella infection, as well as it is used in traveler's diarrhea. Used in traveler's diarrhea. Now next drug is cotrimoxazole. Cotrimoxazole. So cotrimoxazole, actually you should know how actually this drug forms. Trimethoprim and sulfamethoxazole. Trimethoprim and sulfamethoxazole. Okay, so trimethoprim and sulfamethoxazole are mixed in a combination of 1:5, in the ratio of 1:5. Trimethoprim is to sulfamethoxazole is equal to 1:5 ratio. When they mixed, then it forms cotrimoxazole, where this cotrimoxazole is used as a drug of choice. First one is Burkholderia cepacia, Cyclospora, Isospora, next Nocardia, then Sarcocyst, okay, then Burkholderia, cepacia, Nocardia, Sarcocyst, and finally it is also used in Stenotrophomonas, along with piperacillin. Piperacillin is a penicillin, along with piperacillin. Stenotrophomonas, it is used, which one? Cotrimoxazole is used in Stenotrophomonas, where, right? Now we will discuss about daptomycin. Please be on the line. I just come in 2 minutes. Please be on the line. Sorry. Okay. So now we will discuss about daptomycin, right? We'll discuss about daptomycin. We'll make it fast, right? Daptomycin is the drug of choice in VRSA. What is meant by VRSA? Vancomycin resistant Staphylococcus aureus. What is the side effect of daptomycin? It's very important. It's myopathy, right? And where it's contraindicated in pneumonia. Okay, vancomycin resistant Staphylococcus aureus. Now we'll discuss about doxycycline. What is doxycycline? Doxycycline is a tetracycline. It is a drug of choice in mycoplasma pneumonia, and it's the plague prophylaxis. It's very important, guys. Please underline this. It is the drug of choice in plague prophylaxis, right? very important. Now it is a drug of choice in rickettsia. Remember, rickettsia, the drug of choice is doxycycline, then borrelia, then again brucella, it is the drug of choice. Then cholera is the, it's also a, cholera will also use doxycycline, then chlamydia, okay. I think we got there. Now the next drug is erythromycin. Erythromycin is used as drug of choice in pertussis. Very important, guys. You will get an image on pertussis. Trust me. Pertussis, whooping cough, you will get images. Right? Pertussis. Then we'll also use erythromycin as drug of choice in diphtheria. Okay. Note, I will just tell you one thing. Just note this. Erythromycin can be used in the gastroparesis. Remember, erythromycin can be used for gastroparesis condition as a prokinetic drug. Okay. Why? Can anyone tell why? Because the erythromycin has the capability to stimulate the motilin receptor. So due to motilin receptor stimulation, right? Now gentamicin is used as drug of choice for plague. Okay. Now what can another condition you can use gentamicin? Tularemia. Okay. Now another drug is mupirocin. Most of the times you will see in a topical form, ointments, right? It is used for Staphylococcus nasal carrier. But just remember one thing. For this condition, even you can use bacitracin also can be used as staphylococcal nasal carrier drug. Okay. Now mupirocin I already discussed, it's generally used as topical. Right. Now benzathine. Benzathine is a drug for syphilis. Next, it is the drug of choice. Benzathine penicillin used as IM. Benzathine penicillin G can be used in syphilis, Streptococcus leptospira is important. Benzathine penicillin is given in leptospira. Yaws, gas gangrene. Remember this. For gas gangrene also, benzathine penicillin is given because there are high chances of formation of infections or any sort of organisms present in that gangrenous part. So we give benzathine penicillins as a drug. Next, rat bite fever, actinomycosis, meningococcus. Remember, for actinomycosis also we give benzathine penicillins. Actinomycosis. Okay, we give benzathine penicillins. For meningococcus also we give benzathine penicillins. But remember one thing, drug of choice in neurosyphilis. Guys, this time I think I'm expecting question from syphilis. You better read all those things. Drug of choice in neurosyphilis. Drug of choice in neurosyphilis. Can anyone tell me? What is the drug of choice in neurosyphilis? It is IV. It's IV aqueous. It's IV aqueous penicillin G. IV aqueous penicillin G. Now we will come to another drug which is generally used in burns cases, silver sulfadiazine. When I said burns, I think you got what I am about to speak. When I say burns or silver sulfadiazine, you get to know what I am about to speak. Silver sulfadiazine is used in burns patients. Burns patients. Okay. Now coming to the next part, that is vancomycin. Vancomycin. Vancomycin actually it is used in MRSA, methicillin resistant staphylococcus aureus. Vancomycin is generally used as IV in MRSA, methicillin resistant staphylococcus aureus. Now Enterococcus faecium produces an infection called endocarditis. Enterococcus faecium endocarditis, for which we give vancomycin, along with gentamicin also. Enterococcus faecium endocarditis. For this condition also we give vancomycin along with gentamicin. Okay, along with gentamicin. Okay, you got it. Next, vancomycin orally it is given for pseudomembranous enterocolitis. Very important MCQ. Pseudomembranous enterocolitis is treated with vancomycin. Remember. Now note, I just want to write this down here. The latest drug of choice for pseudomembranous enterocolitis is, if it is orally, then it is fidaxostat. If it is orally, it will be fidaxomycin. Fidaxomycin. If it is orally for the treatment of PMEC, that is post membranous enterocolitis, if you want an oral drug to act as drug of choice, you give tecramycin. Or if you want any other drug, you can go for linezolid. Pseudomembranous structures. Wait, I don't want it like this. So linezolid, where linezolid is used? Vancomycin resistant enterococci. Vancomycin resistant enterococci. Now, what are the other antibiotic drugs? First one is tetracyclines. I will write here. You just follow with me. No need of mimicking. Just write here. Just follow with me. Tetracyclines. Okay, just 1 minute.